5, all indoor dining services may operate subject to phase 2 guidance, with the exception of no time may the number of clients be served more than 25% of the tables provided and 6 feet away from them. And right now, we're hopeful that the governor will approve that along with the Secretary of Health. So that is indeed good news. And then Friday, if that's the beginning, we could be in official phase 2 in 2 weeks. Now, in summary, what the city proposed, the mayor and the city council on Tuesday, was to ask the governor and the King County executive to look at the county as sub-areas or city by city. And even though we're grateful that we're at this phase 1.5, we really need to not only accelerate phase 2 for the South County cities that have lower test results on all those measurements we talked about, but have a sub-area city by city approach so that maybe we could get open in phase 2, 3, and 4 more quickly. As you know, King County is the 36th largest state, or could be the 36th largest state. And we don't want necessarily what's going on in Seattle and the other communities that have been affected with those horrible mortalities, basically keep an area like this from opening up. So basically, we're asking the King County Executive, the Council, and the Mayor to look at this proposal for sub-area and city-by-city focus, and then ask for the governor to also allow King County to do this. And so that's where we're at. And of course, we're going to send you the link in a few minutes. We're going to send you the PowerPoint, and we will all keep posted on whether we can make a Friday opening for those services. So any questions? Because I know I buzzed through that, and you're not able to watch the visuals.
Let me just summarize here real quickly that the concern is because of how big King County is. If King County was a state, it'd be I think the 35th or 36th largest in the nation. And the concern is that by putting all of the cities and all of the citizens in one bucket, so to speak, it really does affect suburban communities or rural communities, and having Duval and Enumclaw in Seattle in the same classification, and even Federal Way in South King County. What we're really proposing, we've heard in my conversations and Zoom conferences with both the governor and the county executive, that a city-by-city approach may be too difficult, too time-intensive, and to be able to manage. But that's why we're even thinking about, having the county be designated by sections: South King County, East King County, North King County, Seattle, and get that reopening. Because what we really want to avoid are having organizations and businesses start to fail for a lack of being able to conduct their businesses, and that could get very real very fast. And so that's really what we're talking about. And we sent that letter. So King County was not in a position to go all the way to phase 2 on June 1 earlier this week. And that's why that modification was there. So that's really what we're proposing. We're also, in taking a look at the metrics, wanting to make sure that we're not lumping our letter, that we're not lumping in, cities and areas that have senior centers that have outbreaks, because those are contained units, and an entire community probably shouldn't be, and everything around it shouldn't be prohibited from going to the next phase, because these senior centers, as you know, are pretty self-contained, and you couldn't go to one of those if you wanted to. So at Village Green, right, where we've got a representative there, we've specifically asked the governor and the county executive to pull those numbers out when using this, because those are fairly isolated situations. So that's what we're hoping to see. Any comments on that in regard to our efforts in that regard? And I'll look for hands up here. Got to put my glasses on. Sorry. Randall, go ahead.
Yeah, I am a business owner in Federal Way. And, fortunately for COVID, we were considered essential and still moving, but I have other friends that have other small businesses, and I think this is fantastic, that we're taking this approach. Every day I look across the street to Verrazano's restaurant and see it dark. And, you know, I've been in this building since 96 and they were here long before me, and it's dark. And that
Right.
just, you know, those are people, you know, every dark business is people. And so I
Right.
think pulling the senior centers out, because they really are a little microcosm of their own. They truly are. Yeah, and running a county based on what's happening in some senior centers just epidemiologically doesn't make sense. Um, and breaking it up at least in sections, but I like the city concept even better because some areas are worse than others. You know, so I strongly support what you're doing. I thank you for doing that.
Thanks, Randall. Katie at Village Green, and then Council President Honda.
Yeah, thanks for mentioning the senior centers and senior communities. Village Green, even though there are plans to open up the county or different cities, we are going to be taking it slow here. And we are talking to other communities. We're all doing things slightly different. Some are allowing move-ins. We have not yet. So it's just something we're taking very seriously, so we don't have to do a knee-jerk and close up right away again. So yeah, the next step for us is just going to be something small, like maybe scheduled outdoor one-to-one visits for 30 minutes max. But yeah, we've avoided any illness, and yeah, that's where the senior communities are, and each one's operating under their own type of leadership, but everyone is got orders for no visitors, so it's been interesting.
Right, it has been. All right, well, thank you, Katie. Appreciate it. Okay, Council President Honda, go ahead.
Thank you. Mayor, could you talk about who will do the enforcement of the governor's rules? I'm getting a lot of questions about that. And also, Katie, are you doing regular testing of the folks who live at Village Green for COVID-19?
We have not started that yet. They're doing nursing homes first, and we're more of residential, but we do have an assisted living area that falls under the Department of Health and Centers for Medicare. Testing might be part of our new resident move-in requirements, to test negative and then quarantine in your apartment for 14 days. So that's something that will be to be determined, but it's in the current policy that's being reviewed.
Okay, thank you.
Okay, Council President Honda, in answer to your question, just to let everybody know, we're not having officers go out and enforce the governor's orders with regard to these health. If we ever get called out, it's for we'll do informational things or that kind of information sharing and encouragement. We have not put our officers in the position in which we're enforcing those orders. Actually, we made the decision, instead of going to the council for authorization to incorporate the governor's order into our criminal code, we made the decision not to go in that direction, but for more informational. I can tell you that restaurants and other restaurants and other businesses that have licensure, either liquor control or business licenses with the state, there has been an enforcement mechanism in that. I can tell you when the Twin Lakes Golf and Country Club was allowing some of their members to play golf, I know that the state inquired of the Twin Lakes Golf and Country Club management and through those agencies, and essentially, they were assured that that business was not operating. The club was just allowing some of its owners and members to walk the golf course, and because they were having a problem with non-members trespassing on there. So that's pretty much the state of where we're at. But if we had wide scale disregard of the governor's orders, we would be doing everything we could to discourage that, and we have. So But thank you. Anybody else have any questions or comments on that? We definitely need to get the economy back and moving, and our businesses, as long as it's safe and healthy and socially distanced, and with masks and that kind of thing. But it's also important that we start moving up in this graduated phases, so we can start moving forward. I can tell you as well, with regard to distribution of funds, we had $2.9 million of funds that have been allocated to the city from a Federal CARES Act, and we have $432,000 of CDBG money, and we're in the process of attempting to put that money out into the community and to those who need it. So that's ongoing, and if you've got details about their questions about that, we can get that information to you. Okay, so any other questions about that? Okay, so at this point, we've got a couple of quick questions for our healthcare providers. We've been receiving a lot of questions toward healthcare, and we're curious. We're hearing that patients are not showing up for, serious medical, situations like heart attacks, strokes. Is this misleading, or have you heard this to be true? And I know that we've got people, representatives. Ollie, I know you're here with St. Francis. Thank you.
Yeah.
And sorry, I'm multitasking. And I know we have some other. We've got Kaiser represented and some others. What can you tell us about? What are you hearing in regard to people seeking out medical care during this time?
Francis, we have definitely early on in the COVID wave, severe reduction in volumes across the system. And it wasn't unique for us. And I'm sure it was a combination of, we were asking people to stay home, people were messaging out that we are definitely open for business. We're taking every precaution for both patients to mitigate any risk of any inadvertent exposure. We are concerned that we hadn't been seeing patients lately, for heart stroke, as you described. Volumes are starting to rebound up, but there still is need probably for messaging, letting patients.
Hi, Push, how are you?
In.
Are you at the office?
I am, but I can't connect anything to the monitors.
It's fine.
Oh, could you, whoever's talking, could you please put your mute button on? Thank you.
Are you on speakerphone or something?
Yeah.
There we go. Okay. Go ahead. Were you finished?
Yeah, we just in noticing our ED volumes, we have opened back up for outpatient procedures and testing, and expanded with our surgical volume. We are doing testing of our patients that have scheduled procedures prior to them arriving. So most of them, we would know what their status is for COVID, and we have moved to universal COVID testing of any of our admitted patients.
Okay, good. And I know we've got, and I don't know if we've got Aaron with Kaiser, the Permanente, Krista with Multicare, and Edna with Seattle Children's. First is Aaron on the line? Aaron Mills? Or Krista or Edna? I think I said hi to Edna. Hi,
Sorry.
Krista.
I'm on the line. Sorry, I was a little late joining because of, we had to have a quick huddle around the protesting going on in Tacoma, and how we're now keeping our patients safe from that. But I would echo, we had seen and continue to see a reduction in our ER visits, urgent care. That is picking back up, but it's still concerning because it's, all of a sudden you don't have that many people all of a sudden healthy. Our clinic volumes are starting to pick back up. We are also COVID testing for all procedures, and we test our inpatients. We have, all of the same safety precautions in place as all the other healthcare systems. I also think that there's been a lot of energy and collaboration around working with the other healthcare systems and with Washington State Hospital Association on some marketing campaigns around, get the care you need, it's safe. There's a lot of energy, effort, and collaboration to keep patients across the state safe as they're, getting care. So I think that's that message, I think especially since it's coming from the Washington State Hospital Association does help because it's a collaborative effort with one voice.
All right. Well, good luck down in Tacoma, and thank you. Thank you for that information. Ross Baker. There you are. Oh, I think you're on mute, Ross.
Oh.
There you go.
Yeah, there. Can you see me, Jim?
Yeah, I gotcha.
Okay.
Yep.
We, Virginia Mason and Federal Way and our facilities around Puget Sound are in a similar situation as to St. Francis and Multicare. That's where Krista's at now, right? Yeah.
Yeah.
Come on, did you forget me, my friend Ross? Come on now.
I just couldn't remember where you went. I can never forget you. We have, as with St. Francis, we did experience in March and April and May situations where patients who did have scheduled appointments did not come in, but we are now seeing an increase in care and we are rebounding as well. It is safe to come into our facility, and we are also participating with the Washington State Hospital Association in messaging to patients that it is safe to come in, that we are screening before they come in, and doing all appropriate testing before procedures occur. We would welcome any messaging that helps get the word out that it's safe to come in, and please do not put off your healthcare needs at this time, because it will only lead to worse situations in the future. So,
Well, Ross, you read my mind, because that was going to be my very next question to you and Krista and Edna. Edna, are you still on the line? I know that she was on before.
Hi, this is Edna Shim from Seattle Children's.
Yeah.
I am going to echo everyone else, our fellow healthcare partners. The collaboration has been really tremendous. We are also working with the Washington State Hospital Association, been involved in the weekly PR meetings about the public service announcements to get the word out to do not delay medical care if you need it. Volumes are improving. And also because of COVID, we were taking pediatric patients from our fellow healthcare partners in order to increase their capacity. So it's been really, really heartwarming. Of course, with a lot of the recent events has been challenging, but we have a clinic also in Bellevue that was impacted. But great communication from the city of Bellevue and the police department and our security teams help make sure that Overlake, Kaiser Permanente, and us, Seattle Children's, were always in the loop in terms of communication and could coordinate. So for patient safety and employee safety. So yes, thank you again for coordinating this conference call and meeting with all of us.
Oh, thank you. Thank you. I said, so what would be really helpful? And I think we've got Ruth Smith on the line with Kaiser as well, right, Ruth? Are you there? What would be really helpful, maybe are some suggestions about what we can do here at the city with Tyler and some of our communications people is get this word out. Maybe, for the folks that are part of the healthcare services here in our city, if you could send me a couple quick lines that you would like to see, me, put out. We can put it out on the council Facebook page, and also my Facebook page and on Twitter, about encouraging people to seek medical assistance if they need it, certainly not to delay it. And, and it's obviously we want to make sure people get the care they need. And that really goes to the very core of community continuity. So that's why we wanted to start off with that. Dr. Campbell, and do we still have Dr. Campbell present? I had some questions about
Yes,
schools.
I'm here.
Great.
No, I'm here.
Great. Thank you. So we want to do everything we can. I know everybody here wants to do everything they can. Is there, for the next school year, is there, we just want to make sure that there's an invitation with regard to the schools, that if we can do anything, to assist, and how you're planning this year, or whether it's a call for tutors or volunteers or programs or anything like that. I just turn it over to you at this time to expound on that.
Yeah, I appreciate that. Tim had also reached out to me on your behalf with the same request. So I'll just give you a real quick, concise where we are. We're still waiting on guidance from OSPI to tell us how schools are going to start, and that will be largely dependent on what Department of Health says, specifically related to how many students can be on a bus, how many kids can be in a classroom. Once we know that, we're going to then come up with our design. Once that design is there, then we'll know how our partners can help. One request that I would have is the continued use of Channel 21 to do some instruction specifically for our younger students. That's what we think we'd like to do. And so we will be planning things over the summer. So if you can extend that access out for us, that'll be a way to broadcast learning out to students. And this will be particularly needing something we would need, because if we learn that there's a limit on the number of students who can be in a bus in a classroom, what that means is that students will be rotating into the school district. We would not have them all there. So child care providers, we're going to have to be meeting with them. I imagine there might be a need for child care if that's what the Department of Health says, because kids will not be at school all 5 days. We'd have a quarter of the school on one day and a quarter the next day and the next day, and then students would be learning remotely. So once we know that, in about 2 weeks, we will then follow up with what our needs are. I think the big one is partnering with our community-based partners around support for families who may be in some financial strain because of what's happening with the economy. One of the things that we're doing, we're going to cover the cost of school supplies this next year. We're not going to have, for free and reduced lunch students, it'll be free, and for families who are not free and reduced lunch, Mayor Farrell, it'll be $20. So we're taking that off of the plate of families to help out.
Right.
But we'll still have to provide free and reduced lunch for students. And what I imagine could happen is that some students won't be able to pay those costs. So we want to reach out to the community to do donations towards those lunch balances, because that's something that we know will be a cost that sits out there, along with helping with childcare and the tutoring piece that you're talking about. But I want to know the model first. And once we know the model, and I will know that in about 10 days, then I'll reach back out with more specific next steps and how folks can partner with us. We will have a CBO meeting too in about a week and a half, and I'll make sure we invite someone representing the city to be there, Mayor Farrell, and that'll be another avenue so you can learn what kinds of supports will be helpful.
Okay.
Hopefully that
Great.
made sense.
Great. Does anybody have any questions or follow up with Dr. Campbell? Okay, Tammy, thank you very much. Really appreciate it. And
You're welcome.
that actually really, just in thinking about how that would work in practicality, that makes a great deal of sense to really come in shifts, and you do, a quarter, and then maybe Friday, who knows, how you guys would do that, but makes a lot of sense.
Friday, what we're talking about for Friday is that we would target students who need extra support and extra help. That would be one way that we could think about it. Although we haven't, none of this is I don't want anyone to say this is what we're doing, but this is one option. We're looking at it in three possibilities. We either come back, all students, just like we have in the past. We doubt that that'll be what will happen. There will be social distancing related to buses and classrooms, which means we have to have our kids come in waves. And if they come in waves, that means they'll be at school a couple days out of the week or one day out of the week, depending on what those numbers are. And then the rest of the time, they will be learning remotely. So that's the model. Or we're back like we are now. If the virus gets really bad at some point, it'll be just like it is right now, where it's all remote. So we're wanting to do face-to-face kinds of things. One real quick detail, we know if we are doing this hybrid, we're going to spend some time in late August and September doing orientations for small groups of parents and students coming to the school, learning about what does it look like to social distancing, how will they walk down the halls. We know we have to do a lot of teaching, and we're going to be doing professional development for families so they can understand how to access online learning. Because we know we could get better than what we were doing this spring, even though that was pretty good. We want to get even better if we have to do that again.
Yeah, I actually, Randall, I'll get you in just a second. I was just going to say, you know, having my little guy Benjamin, the way you have done this has been just perfect, flawless from our family's point of view. From the little booklets, I mean, you know, Wendy and I were looking at the little book. You guys, what they did is they sent out like week 1, week 2, you know, and all these emails, and then how you went to the next phase. I have to tell you, just as a parent, and I mean, kind of Wendy and I kind of turned into 7th grade teachers a bit. We had to brush up on our math skills. It was awesome. It was great.
I hate to break it. I hate to tell you, we are going to do the same thing for the summer. We're letting, you know, we dispersed 5,000 laptops, almost 800 hotspots. And this summer, we're going to give what we would call a summer learning expectations every day, where scholars are going to be online, doing online games and things like that, so that we've got to make up for some of what we worry could be summer loss. And we purchased 5,000 additional Chromebooks, so we can have those Chromebooks for loaners for the fall. And we didn't have those funds. We were hoping those CARES dollars will help us to cover the cost of that, because that was about $2 million for that. But and hotspots. I don't know where the city is with continued Wi-Fi access. I don't know if you're having those conversations. That's a big one, access to Wi-Fi. And we're, you know, working on the hardware, but Wi-Fi is a big need for a lot of our families.
Right. Okay. All right. Thank you. Actually, Randall had a quick question. Randall?
Yeah. So for the fall, I know since we don't know the exact model, are you generally planning that extracurricular type things like sports, theater, that type of stuff is probably going to be canceled for the fall then?
Randall, you know, I know WIAA, which is the body that governs our athletic programs. I know they are convening, but all of this will be dependent on guidance from the Department of Health.
I gotcha.
We're waiting to see what Department of Health tells us in terms of the numbers of kids who can actually be together in a space. That's why all of our graduation activities that we just engaged in, we literally had students coming one at a time. We videotaped them, and we're putting that all together in a video. I mean, and I feel really proud about what we did. We bought signs. We had to turn everything on its head for those guidelines, and those new guidelines will determine what we do in the fall.
Okay, perfect. Thank you.
All right.
You're welcome.
Any other questions of Dr. Campbell? All right, thank you. Gosh, I'm really, really impressed. We've got all the healthcare providers. We've got, you know, our Dr. Campbell, who represents 23,000 students and 3,500 staff members, including the teachers. And so we're so blessed to have you guys involved in this. I had a quick question about seniors. Shelley, how are seniors faring now? And is there anything that we should be, you know, paying particular attention to with regard to senior issues?
Well, they're staying home. They're being really good about isolating and staying home and staying safe. And we're in contact with them one-on-one. The building is closed, but the staff is here and working remotely, and we're calling them to make sure they're doing okay. And the biggest thing, though, is the meals and the food bank. Today was food bank. We had more people than we've ever had before. We had about 96 households come through. Then we had churches. We were a distribution center because we're working with Pacific Coast Fruit Company and Northwest Harvest and Food Lifeline. So we had food that came here, and we're delivering it to senior and veterans housing. We're also taking it to churches, low-income housing, shags, and to those that we know in the community that have been coming here, and we're delivering meals. So that's one thing that's been fantastic. We've gotten more food than we've ever, than we used to get in. And that's because of all the help we're getting from these other agencies. And then the churches, they're picking up food and also taking it to their families. And it's also going to some of the school programs. So we're kind of the distribution center. And it was amazing what went on today and how many people are getting food. Now, as far as the seniors go, we're looking at how we're going to open. And, you know, it would be, according to other guidelines, we'll be working with other senior centers, activity centers, and also the National Council on Aging. And they'll be coming, and if we do open, it'll be different than it looked like before. Just like our food bank, they come, they stay in their car, they drive up to the curbside and the dock, and we load their cars with their food. Nobody gets out. All the volunteers are wearing face masks, gloves, staying 6 feet apart. So those are some of the most important things that we're going to be doing when we do have people start coming again. It will be maybe a reservation style. They'll be sitting one person at a table. We may be looking at bingo. The cards would be something that they throw away after they use them for bingo cards. And the lunches would be prepared meals that they just pick up. We'll also be having to work on sanitization and cleaning. And so we're working with these other agencies to help us. But we have most of our members want to come back. They're calling me all the time and saying that they are interested in coming back as soon as we open, but we're also doing virtual programs. So we're keeping in touch.
Very good. Okay, thank you very much. Okay, actually, remember we did the survey the last time we got together, and I wanted to have Tim have an opportunity. Before we actually go to the survey, actually, I did mean to talk with David at UWT. David, how are things going over at UWT?
Well, they're going as well as anywhere else as we adapt. I think we had a reasonably successful shift to online learning for our spring quarter as we've gone through summer. We're gearing up for our first virtual commencement on the 13th, and that's led to some disappointment among students and families, you can imagine, but we're trying to make that as special as we can for them. And then we will also invite those graduates back next year for an in-person ceremony as well as our current plan there. Some similar thinking, obviously some differences, but as Dr. Campbell talked about, as we navigate our decision and try to anticipate what fall will look like, we don't have some of the same classroom size challenges that our Seattle counterparts do. We tend to have smaller classes, which help us when we look ahead to the end of the phasing. It will maybe allow us to have a little more in-person opportunity, but we are still prepared to do quite a bit of hybrid learning depending on programs, whether that means shifting into AV sections of classes on campus, half the class on campus one day, half class the other, then online there. So we'll see how that progresses as far as our ability to open. We are a little ahead of you all across the county, those invisible county lines. We are anticipating a phase 2 designation to come, maybe even while we were talking here, but hopefully today or certainly by the end of the week.
Yeah.
So we're optimistic there. A number of other challenges we're facing peripherally around this. There's some concern we have around changes to our international students and visiting faculty, and some potential reduction in visas there, but happy to answer any specific questions people have, but that's our kind of the broad outlook for our fall plans right now.
Group, does anybody have any questions for David at UWT? Let me just see if there's, okay. All right, well, thank you, David, and we'll certainly be in touch, and certainly thank you for your participation in this. In my first class at UW was History 111, and there were probably about between 700 and 800 people in Kane in Kane Hall. So it's hard to imagine getting back to a situation anytime soon with a class like that's going to be allowed. So, okay, let's go to Tim and let's talk about the survey results. And thank you everybody who participated in the survey. Want to get that information back out to you, Tim.
Mayor, thank you. Almost 2/3 of you responded, so we really appreciate it. And you took considerable time reviewing the documentation and providing responses, so we appreciate it. This was not a scientific analysis by any means, but it did give us a tremendous amount of insight, and comparing this and adding to the Business Resiliency Task Force and their input, it has really provided us with a window inside to Federal Way as it relates to COVID-19 virus. I'm not going to go through all of these, but just quickly, to be succinct with time, question number 3, how has the virus impacted your organization? You've obviously had to increase your outreach efforts. You've had to cancel many events. I suspect many of those, as you were identified, were revenue or fundraising events. Something that we will want to talk with all of you about at length to see what we can do to help and assist. And then it was the top 3 was rounded out by massive revenue losses. So that's significant. As we look forward on, you've had some of you, 50% of you identified that you had to lay off employees. That gets us to another question that comes later in the survey, but we'll address it now. It appears that many of you have been impacted by or your employees, your former employees have been impacted by the fraudulent claim activity that occurred with the employment security department. That's unfortunate. I know in speaking with the chief of police this week, we have nearly 200 complaints on record. So it is significant. And may I also add to all of you, the city of Federal Way has been impacted by similar fraud. And it has not been people who have been laid off. It is people who have been, their ID has been stolen and used fraudulently. And I think we have one of those people online in the way of Bill Vidino, who unfortunately, is that correct, Bill? Yeah, that he was impacted by that too as well. We move on to questions 8 and 9. Has the virus impacted changes in workload? All of you said resoundingly yes. You've had to shift and do more work. The question that kind of caught us off guard on this one is whether you have an internal COVID team or anyone looking after the guidelines and elements associated with your operation. And it was kind of a 50-50 split. If you need help and assistance with that, specifically from our operations emergency manager, Ray Gross, will be more than happy to help and assist you on all of that to get you back open and operating again. I know that it's a overwhelming task, and we'll do what we can to help and assist with you. I turn to highlights in questions 12, 13, and 14. Do you know if your clients or local residents are having problems paying utility bills? Do you know if your clients or local residents are having problems paying rent? Do you know if your clients or local residents are having problems accessing non-emergency health care? All of those were resoundingly yes, and that is an issue that the council, president of the council, Susan Honda, and the mayor are looking at as it relates to concerns associated with paying for rent. And how we deal with that. We're constantly watching that issue at our community development department. Concerns around utility bills are always very important, and we'll try to do as much as we can to help and assist there. And then we've tried to address the issues earlier today with the mayor's questions on non-emergency healthcare, and we appreciate all that input and all that direction. But I think these are some of the insights that have helped us that we really didn't have answers to as we've gone through this, so we appreciate this. Question 16, do you see any issues of personal vulnerability in the community for your clients? And all of you came back and said, yeah, the fear of exposure and isolation to the customers that you're working with. I have a 97-year-old mother, if you can believe that or not, and I call her twice a day, and I'm there on as many weekends as I possibly can, because she is facing that issue, and it is one that I'm concerned about parts of our population here in Federal Way. So I commiserate with everybody and understand the consequences of that. It becomes very stressful. Question 17, do your clients have any specific problems buying products at grocery stores? This was certainly probably associated with the time that you answered it, but shortage of sanitizing supplies makes sense. I think we're still dealing with supply chain issues on that. Here's one that I think is very important. You came back with the item saying food stamps do not pay for many of these items that we need for COVID-19. So maybe there is a policy discussion that we need to have within the community and at the mayor and council president. Maybe you can bring this forward as how we can deal with our congressional representatives, our state legislators, to see how we can address that issue. Staff will put together a staff report, review that, and see what we can do to help everybody try to answer that one. I appreciate that response. Question 18, do you know of anyone impacted by any local stimulus check payment scams? I hate to say this, I've had multiple family members who have died and have been dead for 3 to 5 years, and they received checks. Now, I've held on to those checks because there's no return address to send those checks back to. I don't know if any of you have faced that, but I'm kind of up in the air about what to do with those, but I certainly don't want to commit a crime by depositing them. So they're just sitting in abeyance. I don't know if any of you are facing that or not, but we've seen that, and I've talked to other folks who have seen the same thing. Do you know of anyone having problems getting unemployment? Again, similar answers, both from the business task force, as what you said, about 50% of you said that there are difficulties. Concern that we wanted to make sure we're getting them here daily is issues associated with cybersecurity fraud. Our IT department is answering those, but as individual nonprofit organizations, some of you may be having difficulties with that, and it appears that you are, as 75% of you responded yes, that you were. In terms of gaps in services, this is question 21. Superintendent Campbell talked about it. Child care issues, rent assistance is needed. Our council president, Susan Honda, mentioned on Tuesday night issues associated with support of mental health care, and that was your third ranked element that came out of your response. So apparently we have a considerable amount of work to do in our community in addressing those issues, so we'll be working on those. I think we'll jump over to question 23. What is the most positive thing you have witnessed as it relates to the pandemic? And unilaterally, you all simply said people stepping up in the effort to help others. That's really kind and conscientious. Glad to see that came up. The unfortunate one, and again, you're very conscientious, folks. The most negative thing is the loss of life. So we take that to heart. Those are the answers that, responses, I should say, that you came back with. We thank you for that. We have a workload now ahead of us in assignments that we need to look at. A broad array of how we use our different medias, from Channel 21 to our social media platforms, to help you do your outreach, get to customers and in support of our community. Obviously, there are issues associated with financial support. I might add that the businesses in the city have done well in their efforts to acquire federal funding through economic disaster loans, the payroll protection program. And by the way, that one has still billions of dollars left in it. And if you're having problems as a nonprofit organization and you need help and assistance, we have a triad of the city, the Chamber of Commerce, and the Small Business Development Center at Highline College, working with all nonprofit organizations to ensure that you have that access. One thing I do want to add, Mayor, and again, I don't want to take up any more time, but it's a very poignant issue with all of us in economic development across the state. And as the pandemic occurred and we were dealing with both nonprofit and for-profit businesses, one of the number one things that we found is that organizations have gotten their backs up against the wall. If they're insomniacs and they're up at 2 o'clock in the morning, they may see, and watching TV, they may see an organization that is trying to dispel the ability of getting capital quick and fast and easy. What we're witnessing is the unfortunate circumstance of predatory lending. And our state has really loose usury laws, and we're looking at getting those changed in protection of our businesses and our nonprofits so that they don't get taken hook, line, and sinker. Just give you an example. If you miss one payment, and that payment may be a 5% interest on term, if you miss one payment, it can go to 99%. There's nothing that we have in the state of Washington that can prevent that from happening. So we're looking at making sure that that gets changed. Yeah, that's a dramatic effort. And if you don't read the fine print, there is no ability to have a prepayment opportunity for you. So you're left in almost like a long-term payment that prevents you from expanding your business potentially through equity and collateral positions. So we have those concerns that we're working on. There are at least 6 or 7 major opportunities for nonprofit organizations to achieve or reach out to financial services through the federal and state government, and then some that we're working on right now with a coalition of what's called community development financial institutions, bringing funding for nonprofits and for minority and women-owned businesses. In a report that was just released by the Federal Reserve, over 60% of minority women-owned businesses are borrowing off credit cards. And if you know, in order to substantiate their business, and if you know how expensive credit card percentages are, you know that that's not a good opportunity. So a lot of opportunities for us, conversely, to help the community that we're working with today and the task forces. With that, I'll take any questions.
All right. Any questions, anybody, about that? All right. Thank you, Tim. Had a quick question toward the nonprofits. And I see Robin, Renee, Randall. How are things going with the nonprofits? And is there anything that the city can do at this point to assist? Robin, we haven't heard from you yet. Go ahead.
Sure, thank you. So we are deep in the throes of the renovation on our Fusion Family Center. And I think, you know, the thing I can say most appreciatively is that we appreciate the city's response to making sure that we get our permits and all that stuff taken care of. Our project is running on time currently, and we anticipate our opening will be beginning of September. And we'll be working too, as we get ready to open our after school program there, we'll be working with the schools to try and determine, you know, what those services will look like between 2:30 and 6 p.m. To best serve the kids that will be there in our families. We'll also be looking at a phased-in approach according to COVID requirements to make sure that we're, you know, COVID safe on site. And so we're making progress. We're excited, and we've reinitiated our Collective Impact Coalition, which provides an open table to the boots on the ground, the service providers in the community who are actually doing the work so that we can create access to this project, and also, you know, develop close partnerships to be able to access their services for our families as well.
All right, great. Thank you very much. Great work. Okay, Renee?
I would just say we are very thankful and grateful that we have been receiving the funding from the feds in the city, and it's really helping us through this whole thing. It's been an unbelievable chance for a new start. Thank you.
Thank you. Angela? And then Randall.
So we are we're planning on, you know, opening in October for our season. But it's all, you know, there's so many unknowns as far as gatherings. You know, I'm still trying to navigate the community block development grant, because I don't, from the national or from the statewide arts organization, they said you have to go through your community, and I never saw any information on that, so I must have missed it. But we're, you know, from a financial standpoint, we are, you know, we're still not sure how we're going to make it, but we're determined. We're determined to make it, but it all also depends on what the guidelines are as far as gatherings go. So we're just kind of in limbo, trying to figure out how to survive.
Here, here. Okay. Actually, I heard Gloria Gaynor's "I Will Survive" just the other day, and I was like, "That's a song for now." Hey, Randall, before we get to you, can we go to Robin Korak with the Multi-Service Center? I don't think we've heard from Robin yet.
Thank you. So first of all, I just want to say that we've been very blessed with huge support from the city, from the community at large, just a number of new people also coming out to support us. I think for us, we have closed our offices. We're doing most of our services remotely, with the exception of the food bank, which we changed to allow for social distancing. And I would anticipate that once, you know, we are able to move into that next phase, that we will transition some of our services back to in person, but we're probably going to phase it in. I think our long-term concern is, how do we provide services that are accessible to everyone while mitigating risk? And how do we make sure that in the long term we can still meet the needs, because we know this is going to have a delayed impact or a long-term impact for many of our customers. Thank you.
Thank you. Randall, and then we're going to hear from Cindy over at the Mirror regarding our program that they've got. Go ahead, Randall.
So, yeah, I'd like to echo what Renee said, both on the city and the county and federal level. We've been getting some financial support, which is making a big difference. And I also want to throw out a big thank you to Brian Hoffman over at the Performing Arts and Events Center, because Brian's been really good in staying in contact and kind of giving us a here's what we can expect once things open back up idea. Because in the performing arts, you know, normally we look for a packed house, and that's just not something we can start with. It's just we can't. It's not going to happen. So we've already talked with that and talked about he's also trying to help us find ways to practice, because one of the best ways the studies have shown to spread the virus very far is to sing, because it actually will send the virus out 25 to 35 feet. So we need bigger social distancing for vocal groups to practice. And so Brian's been actually helping us, trying to come up with some strategies so we can practice and get things going as soon as possible. But I just think it's important that, you know, as a city facility, that everybody knows they are working with the artists to try and bring normal back as fast as we can. And I really, really appreciate that.
I would echo exactly what Randy just said, because
That's all I got.
It's been very helpful.
Great. Awesome. Thank you. Okay, Cindy.
Sound Publishing is offering a matching marketing grant. It's very simple to apply for, and it's very short and sweet. We're giving up to $200,000 in King County matching grants. So if you know of anyone who wants to advertise in any sound publishing paper in print or digital, I can help them, and I can get the link out to anyone who needs it.
Okay. Thank you, Cindy. And it's so great to have the paper back in print. What kind of reception did you receive? And was it fun, Cindy, when you went out to your driveway on Friday afternoon? Was it fun to see your paper in the driveway?
It was way more exciting than that. Actually, when I came to work on Friday morning at 9 o'clock, there were 3 piles outside the door, so I was very excited. We actually broke the press because it was such a big paper, so that was a little panic, but a great panic. Had a lot of community support, had a lot of wonderful comments back, being impressed with the new layout, the new size, the quality of the editorial, the big ads. So far, it's just been so highly well received. I'm just really excited.
Well, we're excited to have you back. It's important for a community, especially a community of 100,000 people, thereabouts, close enough for horseshoes, right? To have a printed newspaper, and you're such an important part of this community. I always, go out to the, that's one of the first things I do when I know the paper's there is go out there and see what's in our community, and it's essential for me, and I know it is for our communities too. I want to say how proud I am and thankful that we have this group together. This is really a tremendous group of really, and talking about community continuity. Before we adjourn, I know we've got Council President Honda here and Council Member Assefa-Dawson. Is there anybody, I'll turn it over to Susan here in just a second, but for the good of the order, is there anybody who else would like to say a few words?
Mayor, this is Sheikh Ali from Valley Cities. I just wanted to bring up that at this time, we don't want to lose sight of the behavioral health needs that's out there. And we are open, Valley Cities is open in person, we provide remote services. And during this time of crisis, as we all know, the increase in mental health and addictive disorder becomes really huge. And we have seen, we have heard through the news, and every data indicates the data from Kaiser that came out indicates that that mental health need is big and tremendous at this point in time. So I just want to let the community know that we are open in person and also remote services, telehealth services, and just refer anybody that needs services to Valley Cities, and we'll help as best as we can at this time.
All right, thank you very much. Appreciate it. Council President Honda?
Hi, Jim. It's Dawn. I'm sorry.
No, actually, who's that? Go ahead.
Hi, it's Dawn Coggins. How you doing?
Oh, hi, Dawn. Happy belated birthday.
Thank you. So I'm here, representing the Parks and Recreation Commission, and I just wanted to say, obviously we haven't been meeting as a commission. We've had to cancel, some significant public events, including Parks Appreciation Day and the 4th of July, sadly. But, I am in contact with the Parks Department and to kind of trying to explore maybe alternative or socially distant community events. So we, I think, we could all use something like that at this point.
Hear, hear. All right, thank you, Dawn. Okay, we'll look into that. Susan?
Oh, excuse me. Thank you all for being here. We appreciate hearing from you and learning from you what's going on out in the community. And if the council can do anything for you, please let us know, because we're here to help you. Just send us an email or give us a phone call. I look forward to our next meeting and hearing how the next 2 weeks will go. I hope that they go better than the last 2 weeks we've had. And keep doing what you're doing. You represent our community well.
Yeah. The second piece of what I was going to talk about the past week is that while America is going through this convulsion and these spasms of violence and massive protests, our protest in Federal Way was peaceful and then and respectful and family oriented. And the very next day we did the flag raising for Pride Flag and celebrating Pride Month. And so it's been a good couple of days. And so I'm really proud of our community, and I'm really proud of the group here. Lydia Assefa-Dawson, Councilmember Assefa-Dawson, are you still on the line? I think
sorry,
she's calling.
I am on the line. I'm so sorry.
That's okay. Go ahead.
Yeah. Thank you, Mayor, for this opportunity again. And it was great listening to what people were saying. And I just want to say thank you for the services. As you may have heard, what is going on is still impactful to me. And I'm dealing with it the way I best know how. But I do appreciate your comment, Mayor, when the meeting started and opened. And I really look forward to a continued partnership and friendship and not only what we're doing, but to also be a part of the solution and make sure that Federal Way is a safe place for everyone to call home and a place to work. So thank you for the opportunity. And I hope we get to see each other sooner than later. I miss seeing people, so it's always good to have virtual meetings. Thank you.
Me too. But in some ways, you know, some of the people on this call, I've never gotten to meet before. So, you know, with every situation comes an opportunity, and it's really good to hear from everybody, and we appreciate it. Okay, our next meeting is on Thursday, June 18th at noon, and we'll send out information. And if Bill has not already done so, we'll send out that PowerPoint for you. Anyway, thank you. Take care, everybody. Have a great day. Have a great week. Stay safe and healthy. Okay. Bye.
Thank you. Bye.